Hello. We're going to talk briefly about the emotional side of weight loss surgery. If you're contemplating weight loss surgery or if you've had it before, you will know that there are emotions involved. This will not be a surprise to you. I want to give you some statistics. I want to normalize the whole thing for you, and hopefully that will give you confidence and help you realize that you're right where you need to be. The first thing that I want to look at are the prevalence of mood diagnosis in bariatric patients. About 40% of all bariatric patients have some kind of mood disorder, whether it's anxiety, depression, a combination, or some other disorder. 60% have a lifetime mood disorder. And it's hard to know, chicken and egg. Did the mood disorder cause the overeating? Did the overeating cause the mood disorder? How do they play together? Are they hand in hand? Genetically, does this run in families? There's some research on this, but there's nothing that you can absolutely point to and say this caused that or that caused this. Just know that they occur together. Depression and anxiety are the most common mood disorders prior to surgery. Eating disorders, especially binge eating, large portions, out of control eating, or overfeeding, again, fast eating over large portions, are the two most common eating disorders that bariatric patients encounter. There is some binge purging, but not very often. Night eating is present in 27% of the bariatric population, which is really high. It's 1.3% in the average population. So you can see in our population, it is a higher thing. And that's something that has to be dealt with after surgery too, believe it or not, because of habits and cravings. So that's something that doesn't go away because of surgery. Surgery will help it, especially for a time, but it's something that we want to be aware of and conquer. Also, health-related issues like body dysmorphic disorder, high blood pressure, diabetes, that kind of thing are also present, as well as low self-worth. We start getting and giving ourselves messages that just aren't very healthy. After surgery, there's a lot of improvements, and here are some. Usually our quality of life changes because as we drop weight, we can do more, we feel a lot better, we're more active. Things like blood pressure, diabetes change, and that really helps. Our self-worth goes up, our health-related quality of life goes up, we tend to be more social. Our body image improves, although if we have body dysmorphic disorder, it doesn't go away just because we had surgery. That's something that's going to take a little work and a little help. We often improve our relationships, although our close relationships often are food-based. So we'll go out to dinner, or we'll have people over for dinner, we'll go to their homes for dinner, and so we have to navigate that new social relationship in a different way. And it's up to you whether you tell people that you're having surgery or not, but if you don't tell them, they're going to ask how you dropped the weight so fast, so you want to have an answer ready for them. There's a decline in unhealthy eating habits, especially in the first 6 months of surgery. You can understand that, and we want to keep those declined, so we want to make sure that it doesn't go back to the old way after 6 months. And then also medication to treat mood disorders also declines, as well as medication for diabetes and high blood pressure. That also tends to decline as well. And then there's some concerns that happen following bariatric surgery. Some of these are surprising, some of these are not so surprising. Sometimes there's regrets about having surgery. This doesn't happen very often. I don't see it too often. When it does happen, it has to do with complications following surgery. But that can cause depression. It can cause anxiety as well. Quick weight loss can cause excessive baggy skin, and that can create some body issues. They can be dealt with, they can be fixed, you can have skin removal. I always say that's why God made Spanx, so that we can deal with sagging skin. The bigger ones have to do with worries about plateauing out, not losing weight fast enough, weight gain, that kind of thing. And again, they're very treatable. The proof is in the pudding. Over time, you'll know that, wow, this is real. This isn't just one of those funny diets I got on, and I'm not going to yo-yo back and forth if you stick to the plan. And then a lot of us think, wow, once I have weight loss surgery, I won't have to worry about food ever again. I'm not going to be obsessed with my next meal or what I'm going to eat, or I'm not going to have that food playing in my head in the background. And just because you had surgery doesn't necessarily mean that's going to go away. And that's a big surprise to people. So there's some ways to get around that one as well. Sometimes there's guilt or shame at having surgery because some people consider that the easy way out. The only people that don't consider that the easy way out are people who've actually done it. I love this cartoon. Weight loss surgery is the easy way out. Said no weight loss surgery patient ever We all know how hard it was to do, and if you're contemplating it, know that it's not the easy way out. It's the way out when you've tried everything else and it hasn't worked. It's the smart way out at that point. So, for reflection, write down what your predominant moods and behaviors were before surgery. Were they depression and binging and sadness? Were they embarrassment? Did you avoid social situations? Or did you just stay in there and keep going? Then if you've had surgery, write what they are now, the behaviors and moods. If you haven't had surgery, write what you hope that they will be. And then review those common psychological concerns and see if there are any that fit you, because knowledge is power. And so you want to be able to anticipate them if you haven't had the surgery yet. You also want to be able to work with them if you have. So until the next workout, have a great day.